Hello friends, welcome to Easy Nurse, where nursing education made easy. In this session, we will be discussed regarding BBBSc Nursing second year. The subject is Nursing Education or Introduction to Nursing Education. So nursing education, it's a bit tough subject if you go through all of that, but in this session I have preferably mentioned the most important topics. Okay, so you just have to go through this video, you have just to listen, or if you want to make a short note, make a short note. Okay, and from that only I can guarantee you 80% of the questions will come. So further any delay, let's start the video. So in your question paper, you will see it will be total around 75 marks of question, and in between to write that 75 mark question answer, you will get 3 hours. Okay, so in the first you will have long essays which will be around 2 questions. Okay, explain and the each questions will be around 10 marks each, and the both of the questions you have to answer. Then you will have the short essay questions which will be around 5 marks each, and there will be 7 questions. Okay, next one is the short answer questions. Will be like the answers will be 2 marks. Okay, and there will be 10 questions. Okay, so in this session I have mentioned the most important questions, and that only which are difficult to understand I will explain that, and rather than that other some of the other topics also which are very important and they tend to come in your exam, I have explained that as well. Okay, so in this session let's discuss whatever the important topics are. So start with a long essay question. So before that I will let you know what are the principles or what are the basic objectives are there that you should mention in the long essay questions whenever you are writing the answer. The first one is first to understand the question what they actually have asked. Okay, and once if you know the answer properly, try to write it how much you know. Okay, don't try, and please don't repeat one single sentence for multiple times. Sometimes it actually distracts the examiner from the actual answer that you have given. Okay, and whenever you are starting, if you really briefly know about the topic, try to give an introduction, definition, okay, as per the topic preference. Okay, especially whenever you are trying to excuse me. So whenever if they ask about the types and all, if you are writing the types, try to do in a such a manner, maybe you create a box, okay, a table, and then you give the answer and later you can explain, or either you can make a flow chart or division or hierarchy. Okay, and like that you can explain. But directly going into paragraphs, or if you don't want to put that much effort also, what you can do is just give the answer point wise if you are doing the types. Okay, but giving in a paragraph, what it will do, it will distract the examiner to focus on your answer sheet. Okay, they will think you may have, like, maybe sometimes, not all the times, they usually avoid the paragraphs from reading because it is very difficult to give much more attention to the paragraph. So either you write in a point, or you make a table, or you make a hierarchy, especially for the questions where they have asked types or division, okay, comparison, okay, this kind of things, or they may have asked process. So for those things you try to do this kind of thing. Okay, so our first long essay is principles, advantages, disadvantages and different teaching methods in nursing. So let's know what is excuse me. Okay, so let's know what is mean by teaching. Teaching is a process where a person will be giving knowledge, information regarding a particular subject, a particular topic to other people. Okay, it can be an individual, it can be a group, it can be a community. So there are different teaching methods in nursing education. There are demonstration, lecture, project method, many more. Okay, one by one we will discuss. So first let's discuss about the demonstration method. So demonstration method is mainly focused on the learning by observing. What is meant by that? If you are seeing a procedure, okay, by seeing that whatever you are learning is considered as demonstration learning or demonstration learning method, and the way the teacher is teaching will be called as demonstration teaching method. So what are the principles if you want to teach your students, okay, or the teacher is teaching you, what are the principles he have to maintain or she have to maintain is learning by observation and imitation. See one, do one, teach one. Okay, first to learn. If I am a student and I am learning from the demonstration method whatever my teacher is teaching me, first I have to see one, then I have to do that procedure on someone, then I can teach to other people as well. So this is the main process. Okay, see one, do one and teach one approach. And it also encourages the psychomotor skill development, because not only you are listening to theory, you are practically doing that as well. Okay, then is advantages. So what are advantages of this method? Especially they were effective for skill based learning, which are procedures. Okay, promotes better retention and combines theory with the practical or practice. But there are disadvantages as well, like it is very time consuming, obviously, because one by one you have to demonstrate it, or maybe you have demonstrated in between the group. Okay, everyone have seen, still they have to perform, and especially while performing such medical procedure you should guide them. Now you at it single time you can guide them together, right? So what you have to do, you have to give attention to each of the students, and when you are doing this it will be very time consuming. So for all the procedures it is not possible to give to teach in a demonstration method. Okay, so that is very time consuming. It requires equipments and preparation. Okay, beforehand only you have to excuse me. So beforehand only you have to prepare for this, you have to prepare for the equipment, you have to make a proper plan or set a proper day when every student will come and every student will be present. Okay, lastly, limited for large group, especially if your class contain like more than 100 people and all, it is very difficult to teach by demonstration method in such a large group. Okay, because sometimes it can take 2 to 3 days to demonstrate a single procedure to that much large group. Okay, so this is about the demonstration method. Next one is lecture method. This is the most basic method that have been used from periods and decades in school, colleges. Okay, so lecture methods is actually teacher-centered learning, mainly where the teacher will give the lecture, the information to the students. Student will heard it, try to learn from it, and they will keep a record or write it as a notes in their books. Okay, it is organized presentation of facts. Right now I am giving kind of a lecture. It's not properly lecture. Why I will say, right now if you want to ask something from me, you can comment in the comment box. I will give the answer. I will try to interact with you. But in the most of the lecture cases or lecture centered learning, what happened, teacher will give the lecture, students will write the content and all, and or student will record that, and later they will learn from it. And if you say about that, student can ask the question from the teacher and teacher usually give the answer, that is also a teaching method, but it's coming under discussing. Why I will say, because when a teacher is giving the lecture, you are listening it, you are writing it, over. It's a one-way communication. Okay, but when the students is asking questions, he or she is discussing with the teacher, so it's become a discussion method. Okay, so that is the difference, main difference. And especially in the lecture method, we have to rely on the verbal communication in between the student and the teacher. So what are the advantages of lecture methods? It's covered a large content in a short period of time. It is suitable especially for the large groups and economical and easy to organize. Okay, you don't have to pre-plan for months and then you can give the lecture. It's not like that. You can just plan it easily. Okay, and if it is sometimes if you are a professional and have a experience, you can do it. You know, suddenly if the class will be arranged, then also you can do it. Okay. So these are the advantages. Now come to disadvantages. This is a passive learning. Why I already said, because students are not discussing it with the teacher. Okay, they are just collecting the information. So they are not actively participated in the communication. So that's why it's a passive learning. And it is difficult to assess the understanding, especially for the teachers who are giving lecture method. It's not they are not able to collect enough information or to analyze whether the student have already answer and understood the topic or not. Okay, it is also not suitable for skills and attitudes. Okay, so these are the disadvantages, advantages and principles of lecture method. Next is discussion method. Already I have told. So it is the interactive and learner centers. Mainly it will focus on the students, okay, or the learners. It promotes the idea exchange and critical thinking. So here what is happening in between learner and the teacher or the whoever is giving the information, okay, main information, in between them the idea will be exchanging and it will promote the new ideas. Also it will increase the critical thinking ability. What are the advantages of this method? It will improve the reasoning and communication. It will increase the participation and motivation for the students, and the aid problem solving and decision making. Okay, so these are the advantages. Now come to disadvantages. This needs skill facilitator, because sometimes the discuss method can be turned into a fight or a battle. It may go off the topic, okay, from discussion. If the group, whoever is discussing on a particular topic, if they are not focused, or whoever is leading the discussion group, okay, if he is not focused enough on the student or whatever the topic that they are discussing, they can divert it from the topic to another topic. Okay, and it is time consuming as well. Excuse me. So these are the disadvantages of discussion method. Next is role play. Role play is a very active, especially nowadays. If you see, role play plays a major role in learning, because I don't know if you have observed or not, whenever you see a picture or whenever see a movie, okay, if you don't understand, if I will tell you a story, you may have not remember, but if I will show you one movie, in between that same story, or I will show you a video, okay, you will remember the story more, you will understand it more, because your two sensory systems are actually working with both. Okay, like your two sensory part are working together, like your eyes, your brain and your ears. Okay, so that is the main thing. So role play or simulation is actually a very active learning method. So here we will learn it through the active participation, and it is based on the experiential learning. Okay, what are the advantages of role play methods? So it builds confidence and empathy, improves the communication skills, provide the safe practice environment. But there are some disadvantages. It may cause anxiety or shyness and requires time's preparation. Okay, so this is the role play method. Next is project method. So project method, it's a digital method. The main principle is to learning by doing, problem solving. Okay, encourage the independence and grouping. So what are the advantages? It includes promote creativity, teamwork and link theory with the practice. And disadvantages are it is time consuming and assessment may be subjective. Okay, so these are the main types of teaching methods. Come to the next question, which is curriculum. So what is curriculum? Curriculum is a kind of a activity or experience where you can gain the knowledge. It can be based on theory, it can be based on the practical. Okay, it have to be related with your academics. So curriculum is totally of experience. Okay, totality of experience which can be planned and unplanned, that a student will undergo the guidance of a teacher in an educational institution. Okay, so curriculum activities, if you say, it can be academic or unacademic. Okay, so academic include test, okay, annual exams, mock test, quiz and all, and unacademic include sports, okay, or related like workshops and all. So the process of curriculum planning and development includes situational analysis. So what is that? It is the study of learners, teachers, institution, community and professional needs. What is the main aim and objective of curriculum? Why we should provide or why we should encourage the students in doing the curriculum? Because the set board's aims and measurable objectives are based on the required competencies. Okay, competencies. The content selection will be on choose relevant and updated material as per the objective, and content organization will be arranged logically, simple to complex, known to unknown. Other than that, we can also experience learning, select suitable methods, clinical practices and simulation and projects. Organization of in the organization of experiences, we will be integrate the theory and the practice, use the interdisciplinary approach. The evaluation will be used continuous and final assessment for students and curriculum. The feedback and revision will be modified based on the evaluation and new healthcare trends. Next is structure and function of INC and SNA. First, let's talk about INC on Indian Nursing Council. It established under INC Act 1947 by headquartered in New Delhi. The members are included as President, Vice President, representative from the state councils, UGC, MCI, armed force and institution. What are the functions of INC? Maintain the standard of nursing education, recognize the qualification Indian and abroad, approve and inspect the institution, frame syllabus and curriculum, keep Indian nurses registered, advise the government on nursing matters. So these are the functions of INC. It have been came 2 times. Okay, so this is very important. Okay, mark this. At least if this will not, if this will come or may not come, but the functions will definitely come. Okay, next is structure and function of the SNA. So the Student Nursing Association or SNA structure is at unit of TNAI in the each nursing college. The office bearers will be president, secretary, treasurers and faculty advisor. What are the function of SNA or Student Nursing Association? So they will promote the professional growth and leadership, organize the educational and cultural activities, encourage the community service and researches, and link the students with TNI and INC. So this is about the INC and SNA. Next is phases and skill of micro teaching. So what is mean by micro teaching? So micro teaching is a teacher training technique which will be providing feedback on the teaching behavior under controlled condition, like development at Stanford University in 1963 by Allen and Ryan have been defined this. Okay, so what is micro teaching? So in a controlled manner and behavior, when the teacher training is giving to the teacher on the feedback of how they have taught. Okay, so there are phases which include orientation, which is introduction and concept of the process, skill acquisition, which is practice specific teaching skill in short lesson for small groups with the feedbacks. Then practice, where we will plan, teach, feedback, replan and reteach, which is called as micro teaching cycle. Okay, this can also come for 2 marks, micro teaching cycle. Then lastly we will do the evaluation, where we will assess the improvement and effectiveness of skills. Okay, so what should be the core skills of a teacher? There should be set induction, questioning, explanation, reinforcement, stimulus, variation, blackboard use, and closure. The micro teaching cycle includes first plan, then teach, then get a feedback, then replan, then reteach and get a re-feedback. So this is the cycle of micro teaching. Now we have discussed some of the long essay questions. We will move on to the short essays. Okay, so what are the short essays? I have mentioned here 8. Okay, let's discuss one by one. First is types and function of audiovisual aids. So what audiovisual aids are? These are something called as, props. Okay, props of teaching, you can say it. So these are the instructional devices that both sound and visual components to enhance the teaching and learning. Okay, there are different types of aids such as audio aids, visual aids, projected aids, audiovisual aids, and electronic modern aids. Okay, now audio aids include radio, tape recorder, podcast, microphone, language lab. Okay, then visual aids include chart, posters, models, flashcard, maps, and diagrams. The projected aid include LCD projectors, slides, film strips, or OHP or overhead projector. Audio-visual aids include television, computer-based multimedia, video, and smart board. And lastly, electronic or modern aids include PowerPoint, e-learning tools, simulation, and virtual reality. Okay, so these are the types of aids and their example. Come to the function. So what actually aids do in teaching or learning process? They will motivate the students to assure the curiosity and sustain the interest. Clarification, where simplify the complex concepts. Okay, retention, where we will enhance the memory through the multisensory learning. Okay, as I have already told, we will use our multisensory organ for the learning. Okay, then reinforcement, where we will strengthen the previous knowledge. Participation, it will promote the active involvement. Realism, bring real life situation into the classroom learning. And lastly, time saving, because it's explained more in less time. Okay, so these are the types and function of audiovisual aids. Let's see next, which is characteristics of an effective or ideal teacher. This is also a very important question. Okay, and previous one also. This will come definitely if from this. Okay, any of the questions can come 2 marks or maybe 5 marks. Okay, even 10 marks also. Okay, so don't forget to read that. Okay, next is characteristics of an effective teacher. So what are the characteristics? For the personal area, the teacher have to be confident, enthusiastic, patient, adaptable, and emotionally balanced. Okay, then as a professional side, he have to be well prepared, punctual, organized, and up-to-date knowledge while taking the class. The teaching skill should include the good communication, clear explanation, use of AV aids. Attitudes, their attitudes towards students and other members have to be respectful, empathetic, and encouraging towards the students. The evaluation skill should include fair and objective in assessing the students. They should not prioritize, or they should not do partiality in between the students. Okay, and especially favoritism. Okay, lastly, mentoring, which will provide the guidance, feedback, and motivation to the students. So these are the main characteristics of an effective teacher. These are the very simple words. I know you guys can understand these words. Okay, try to write it down in a notebook, so at least if you remember 2-3 words also, you can explain in the examination. Okay, so move on to the next one, which is qualities and responsibilities of a clinical instructor. So clinical instructor is completely different from a teacher. Not completely, I will say, but most of the qualities are different. Okay, such as the qualities of a clinical instructor should include sound clinical knowledge and skill, good communicator and role model, patient, approachable, and observant. Okay, professional and ethical in a behavior, adaptable in individual learning needs. So these are the main qualities of a proper or ideal clinical instructor. Now what are the responsibilities a clinical instructor will have? So they have to do planning, they have to prepare for clinical teaching plan and objectives, especially the trainee nurse, assign the students to patients appropriately, guidance and supervision during the students are giving care, okay, demonstrate nursing procedures and supervise practice and correct the errors. Evaluation, they have to assess the performance through the observation and checklists. Also they have to provide the constructive feedback. They have to do the coordination, collaborate with the staff and the educator, record keeping where she or he have to maintain the attendance, evaluation forms and reports. And lastly, they have to be professionally developed to keep updated in new nursing trades and techniques. So these are the qualities of a clinical instructor. The next one is, okay, so the next one is steps in developing developing a question paper. Okay, so if you are a nursing teacher, nursing tutor, okay, or you are a professor, assistant professor, sometimes you have to prepare a question for the nursing students, your students, right? So how you can make question paper? Okay, so there is a proper process. First is to define objectives. So based on the course outcomes and the Bloom levels, okay, at the basic level we have to define the objectives. Then we have to do a blueprint preparation where we will distribute the questions by topic and difficulty, like easy, moderate and hard. Then we have to decide the weightage in the sense how much a question should carry, how much marks a question should carry. Okay, then frame the questions, like prepare different types of question, MCQ, short, long, case based. Okay, like you may have seen, okay, Mr. X have 35 years of age with this symptoms, what will be the nursing care plan, okay, what is the health education you have given. Okay, so that are case based. Then after that you have to review the validity, we have to check the clarity, accuracy and relevance of the particular questions. Then moderation, if it is already feedback by yourself, you should check do a quick review with your PR team or your colleagues. Okay, so peer review to ensure the fairness. Then editing and formatting, ensure proper instruction, marks and structure. And lastly, printing and confidentiality, we have to maintain the secrecy and security of the question paper. So these are the steps in developing a question paper. The next one is importance and steps of evaluation in education. So what are the importance and steps of evaluation in education? First, let's discuss about the steps in evaluation. So in the evaluation, before doing evaluation, you have to do planning, where you have to identify the purpose and the objective of the questions. Then tool selection, you have to choose the appropriate tools like test, assignments and observation. Then data collection, you have to administer the evaluation tool. Interpretation, where you will analyze and interpret the result. Feedback, where you will inform the students about their performance or them by their marks and all. And re-evaluation, we have to modify the teaching learning based on the feedback. Okay, so this is the steps of evaluation. Okay, this is also very important. Now why this evaluation process is important in the education? First of all, it will measure the achievement of learning objectives. It will identify the strength and the weakness of the student. It will improve the teaching methods, provide the feedbacks from the learners and helps in curriculum development. So these are the importance of evaluation in education. The next one is individualized instruction. So what is that? Individualized instruction is a teaching method again. Okay, it's come under teaching method in which the learning experience are tailored to the need, pace and ability of each learner. Now how I will say, For each patient there will be different signs and symptoms. So as a nurse you will treat differently. How the doctors will, if the doctor will also prescribe medicine, he will get different medicine for different patient as per their particular problem, their particular needs, age, sex, health status, or maybe the weight or height, right? So for this also, for different kind of student as per their their knowledge, their need, peace and ability to learn, we will give a personalized individual learning teaching method. Okay, so what are the main features of this method? It include learner centered and self-paced, so we can focus on a single student at a time. Okay, then teacher acts as a facilitator of a students. Here we should use of a program learning modules, self-instructional materials. Okay, so further the student can lead himself for studying on his own, and continuous feedback and assessment. Okay, so these are the features, these are the features of individualized instruction. Now come to advantages, why we should do this. Okay, what are the advantages we will get from individualized instruction method? So it will promote the self-learning and responsibility of the student, accommodate different learning styles and encourage the mastery of the content. But there are such limitations, especially for the students, which are, it is very time consuming for teachers, difficult for the large group and limited peer interaction. Okay, so that's why it has been limited. Okay, individualized instruction method. The next question is programmed instruction and advantages and limitations. Okay, so what is programmed instruction? These are actually a self-learning method where the content is presented in a logical sequence through the frames or with the immediate feedback. How I can say? If you go in Easy Nurse app, okay, so this is a very good example here. If you go in the Easy Nurse app, already we have prepared all the materials, notes, video, lectures, okay, whichever you will find difficulty in. So what you have to do, already it is prepared, already is, it is kind of a spoon feeding. You just have to take the spoon, you just have to eat it. Okay, so like that, if you go in the Easy Nurse app, you have to check every video, you have to study. If you want to make your own notes, fine, listen to the video, try to understand. Okay, if you have any doubt, ask in the community forum and make your own notes. If you don't want, still we have a backup plan, we already made the notes, you just have to read it. Okay, so that's what it is, a programmed instruction. It's already programmed, you just have to study it. Okay, and through this you can get an immediate feedback. Okay, so that is what this is called as program instruction. Or if you have ever attended any kind of mock test, our Easy Nurse also have provided for so long. Okay, still it is there. If you want, you can go and give a mock test. So in that, what you will do, we will give some MCQs. There you will choose the proper answer, whichever you feel which is correct. Okay, and as soon as when you finish giving all the answers, we will give you the result. Okay, so this is called as programmed instruction. Now there are types such as linear programming, which is Skinner, sequential and step-by-step, branching programming, which is Crowder, provides an alternative path based on the learner response. What are the advantages? The advantages of programmed instruction include promotes the self-learning and active participation. It will provide the immediate feedback. Learners will progress on their own pace and reduce the teacher's workload. But there are such limitations also, like preparation is time consuming and costly. I will tell you, Easy Nurse is not at all costly rather than the others app you see in market. Okay, I'm not trying to promoting it, but that's just an example so you can understand. Maybe through this video you are seeing, you are exploring the Easy Nurse, but you don't know what is inside there. There is not such videos which will say whatever is inside there. So that's why I am telling you. Okay, so it's not at all costly, it's very pocket friendly, and we are giving discounts right now also. So if you go in the Easy Nurse app, you can just purchase or give a call on our official number. Okay, and we will be very happy to help. as soon as you purchase the app, all of the courses, videos, notes will be available in your phone. You don't have to search in YouTube, you don't have to search in Google, you don't have to use ChatGPT, you don't have to rely on Gemini, anything. Okay, you just have to download, purchase, read, and get passed with very good marks. Okay, and still if you feel problem, there are featured teachers are there, they're very experienced, well experienced. Okay, they will be 24/7, they will be there to help you and guide you, especially for the exams. Okay, so enough of promotion, let's move on to the next point, which is lack of personal interaction. Okay, there are in other apps, I will say, there is lack of personal interaction, not suitable for developing affective or psychomotor skill, and it can become monotonous. Okay, so these are the limitation of program instruction. Now I have discussed all the short essays also. Let's move on to the short answer questions. Short answer questions are sometimes bit tricky. Okay, why? Because sometimes you don't understand what is actually have asked, and sometimes what you will do, if you will give too short answer. Okay, you can do that if you know the correct answer, you can do that, but if you don't know the answer, at least try to attend it, so the examiner can give you at least 1 mark for the answer. Okay, so our first question is, state 2 types of learning. So there are cognitive learning and psychomotor learning. Cognitive learning involves acquisition of knowledge and understanding, where psychomotor skill involves physical skill and coordination, like in the practical. Next is curriculum. We have already learned what is that. Mention 2 barriers of communication. This question also very important. Okay, barriers of communication: language barrier, use of unfamiliar or complex words; psychological barrier, which is fear, anxiety, lack of confidence in the communicator or receiver. Next question is, write 2 advantages of demonstration method. This also we have just learned. Promotes better understanding, helps in development of psychomotor skill. The next question is, mention 2 functions of INs related to nursing education. So they are prescribed, okay, prescribes and maintains the uniform standards of nursing education and the colleges rules and regulation, recognize and approve nursing schools, colleges and programs. Okay, next, define motivation in learning. Okay, so motivation, this question have came 2 times. This is very important again. So what is this? Motivation is the internal drive or desire which will stimulate and directs an individual to engage in learning activities and achieve goals. Okay, so that is motivation. Next is, what is formative evaluation? So formative evaluation is continuous assessment done during the teaching learning process to monitor the student progress and improve learning. Like a teacher is continuously taking task or continuously taking test, surprise test and all, just after like the next day of teaching you. Okay, so that is continuous teaching, which is called as formative evaluation. But there is summative evaluation also. What is that? It is actually in the end of the year or in the end of the courses, particular semester or the year. Okay, what they will do, they will conduct an exam and they will evaluate your knowledge, okay, throughout the year what you have learned. Next is, mention 2 uses of nursing rounds. Nursing rounds, especially in teaching learning method, is very important for the observation on the students, which are, they will provide the opportunity on the bedside teaching and learning and helps to evaluate student clinical knowledge and skill in real situations. The next question is, write 2 characteristics in good question paper. First of all, valid, measures what it intend to measure. Clear and unambiguous questions are simple and precise. Lastly, define objective type questions. So what are those? Objective type questions is a form of assessment with fixed correct answer. Minimize the subjectivity marking, which is called as multiple choice, true or false, fill in the blanks questions, these things. Okay, I have discussed most all of the important questions. Other than this also there are some important questions. Let's just discuss, and from there I will tell you 80% of the questions will come at least. Okay, 80% of the questions will come common. Okay, so do not forget, if you want to take a screenshot, print it out, read. Okay, If you can't find in YouTube, you go in the Easy Nurse app and you can search for the answers. Okay, so first is discuss in the detailed process of evaluation and its tool in nursing education. I am telling you, I will not repeat it. Please just note it down, or you want to take a screenshot, take a screenshot. Okay. Explain the difference between audiovisual aids and their importance in teaching learning process. Describe the role of a nurse and teacher in guidance and counseling of the students. Define communication process types, barriers in communication. Discuss the philosophy of aims and objectives of nursing education in India. Explain the lesson plan and its purpose, format, importance in nursing teaching. Discuss the various methods of clinical teaching and their advantages. Explain the levels of educational objectives and their importance in teaching learning. Define the teaching and learning. Discuss the relationship between two relevant theories. Explain the use of technologies, simulation in modern nursing education. Discuss in the detailed steps of organizing and continuing the nursing education program. Describing the role of evaluation in improving teaching learning outcomes. Next is short essay questions. So here also some important questions are there rather than whatever I have discussed. Write it down. Explain the maxims of teaching and with example. This is a very important questions. Okay, do not forget to read it. Describe the role of the teacher in the classroom. Discuss the importance of lesson planning. Explain the steps in conduction a demonstration. Write advantages, disadvantages of lecture method. This also have been came for 2 times. Okay. Explain the principles of curriculum construction. Discuss the process of communication, teaching, learning. Describe the process of counseling, nursing education. Explain the characteristics of good curriculum. Discuss the factors influencing learning. Next are short essays, which include explain the importance of nursing education, describe various methods of clinical teaching, discuss the teacher's role, research and innovation, explain the use of computers in nursing education. This also have been came, it can come for 2 marks or 5 marks. Okay. Then write a short notes on seminars and workshop. Explain the characteristics of good instructional objectives. Discuss the need of the evaluation in teaching learning process. Then define curriculum in the short answer questions. These are also very important. Okay, write it down. Curriculum planning, education, mean any 2 principles of teaching, write 2 objectives of nursing education. State any 2 laws of learning. Write the purpose of clinical teaching. Mention 2 characteristics of a good test. What is micro teaching? This is very important. Mention any 2 criteria of a good audiovisual aids, again important. What is evaluation in education? List any 2 qualities of a good teacher, important. Names of 2 modern methods of teaching. Define lesson plan. What is difference between the guidance and counseling? Again very important. Okay, mention 2 advantages and of audiovisual aids. Okay, so in this session I have mentioned all of the important question. If you still have missed someone, go back and check in the Easy Nurse YouTube channel, because it's a recorded video, so it will be there in our channel. Still, if you have any confusion, go in the comment section and comment whatever the need you have or whatever you don't have didn't understood. We'll be very happy to help you. So best of luck for your exam. See you in the next session. Till then, keep learning and keep exploring with Easy Nurse. Thank you.